muscles do that? We have an extensor, pollicis, longus, and brevis. Okay, if I wanted to emphasize the brevis more, give my resistance at the proximal phalanx, emphasize the longus more, stabilize the proximal phalanx, and give resistance at the distal phalanx. Hold it right there and don't let me move. Work on that a little bit. All right.
That's what I have time to do right now. Just work on my hand strength.
All right, so remember the extensor pollicis longus is one of those tendons of the anatomical snuff box. So you should be able to palpate that. Is the extensor pollicis brevis one of those?
Yes.
It is, but it's right with the abductor pollicis longus, so it's hard to distinguish the extensor pollicis brevis out of that. All right, now,
Is that the brevis?
oh, look at that. Actually,
Or is
that
that
is
something
the
else?
abductor pollicis longus. This is the extensor pollicis brevis right
Okay.
here, going up to the front. That's pretty neat.
See, I'm stronger than you think.
All right. Okay, what's this motion right here?
Abduction.
Okay, so abduction. What muscle does that?
The abductor pollicis.
Longus and
Brevis.
brevis. Okay, so to emphasize the brevis, I give my resistance on the actually both of these go to the CMC, don't they? Yeah, so I give my resistance on the first what? Metacarpal. And my resistance is in the direction of what?
Adduction.
Adduction, right? So she's doing abduction. I'm trying to push her into adduction, which occurs at the CMC. So I'm pushing here, stabilizing here. All right. Can I palpate the abductor pollicis brevis?
Yes.
Yep, I can. That's part of the hypothenar eminence right there. Can I palpate the abductor pollicis longus? That's part of that anatomical snuff box right there. So pay attention to the palpation. All right, and then if I'm testing the adductors, okay, hold your thumb against your palm and don't let me pull it out. What muscle does that?
The adductor pollicis.
Adductor pollicis. And I could test this motion, hold it right there and don't let me pull it back. And again, where am I giving resistance? On the first metacarpal, because this is a CMC joint motion right here. Opposition is a CMC motion. I should have that in the notes. Yeah, thumb, CMC, opposite. Okay, so as you're doing the hand, the big point is just think about, which joints are moving, where precisely you give your resistance on what bone, and palpating when you can the muscles or the tendons that do those motions.